Our featured speaker today is Dr. Alison Pattison, founder and CEO of Arizona Provider Training. She will be speaking on mental health first aid and will also get into specifics with regard to our elderly population. Statistics that will surprise you. As a mental health first aider, you can be the one to make a difference in the life of someone with a mental health challenge. Your actions can be a first step in someone's recovery journey. Alison, please tell us more.
Okay, well, thank you so much for having me. I am looking forward to the conference in August as well. And just want to kind of give you a general overview of what we're going to go over today. So I'm sure that maybe you've heard that May is Mental Health Awareness Month. So it's a perfect time to kind of discuss this program. So I also, and by the way, I'm just admitting people since I'm now the presenter. Anyone who pops in, am I okay to admit them?
Yes, and I'm watching that as well.
Okay, great. All right, so I'm going to give you an overview of mental health, specifically older adults. And then we're going to get into if you take a mental health first aid class, there's an action plan that we teach called Algae, and I'm going to go through that with you. And then have some resources that I wanted to share today as well. So just to start, looking at some key facts, and this is specific to the elderly population. 1 in 4 older adults have a mental health condition, and more than 1 million adults age 65 and up have had a substance abuse challenge. This one is particularly surprising. Males 75 and over have a higher rate of death by suicide than any other group. And we see this population growing from this year to 2050. The proportion of the world's population who is over 60 years old will nearly double from 12% to 22%. So I want to first talk about why it's important to take care of our mental health as we age. As we age, people may experience certain life challenges or changes that may impact their mental health, such as coping with a serious illness or possibly losing a loved one. Although many people will adjust to these life changes, some experience feelings of grief, social isolation, or loneliness, and that's absolutely understandable. When these feelings persist, they can lead to mental illnesses such as depression and anxiety, and other mental health illnesses. Mental health is important for every stage of our life. Effective treatment options are available to help older adults manage their mental health and improve their quality of life. And we'll get into some of those resources. But I just wanted to kind of remind everyone that as we age, if we are taking care of ourselves, we'll already be in that practice, and it will be an easier transition as we age. So I want to look at some of the symptoms of mental disorders in older adults. And we all want to be aware of changes in a person's appearance and behaviors, and to listen and respond if an individual, is describing thoughts or feelings that can indicate a mental health challenge. So some of the things that we might see could include noticeable changes in mood, energy level, or appetite, feeling flat or having trouble feeling positive emotions, difficulty sleeping or sleeping too much, difficulty concentrating, feeling restless or on edge, increased worry or feeling stressed, anger, irritability, aggressiveness. We could see ongoing headaches or digestive issues or pain. We can see misuse of drugs or alcohol, sadness or hopelessness, thoughts of death or suicide attempts, engaging in high-risk activities, obsessive thinking or compulsive behavior, seeing, hearing, and feeling things that other people do not see, hear, or feel. It's really typical for adults, especially older adults, to experience ups and downs in their thoughts and feelings. That's a normal part of life. So how do we recognize when the signs and symptoms we're noticing are becoming a mental health challenge? Well, the simple answer is when it is starting to cause impact in their lives, when the signs and symptoms are happening a lot, most of the time, and when the signs and symptoms have been occurring for a while. So we can use 3 categories to determine if the signs and symptoms are becoming a mental health challenge. And those are on your screen: frequency, duration, and impact. So frequency, how many signs and symptoms does the individual have? And how often are the signs and symptoms occurring? Okay, then we can look at duration. How long have the signs and symptoms been present? And then impact. Are these signs and symptoms interfering with the person's ability to function? Okay. And one thing that we talk about a lot with mental health first aid is that we are not diagnosing, we are just noticing. We're noticing signs and symptoms. So I want to talk a little bit about what mental health first aid is. And this little guy here, this koala bear, is their mascot. And I'll tell you a little bit about why. But mental health first aid is an early intervention public education program. It teaches adults how to recognize the signs and symptoms that suggest a potential mental health challenge. Also, how to listen non-judgmentally and give reassurance to a person who may be experiencing a mental health challenge, and then how to refer that person to appropriate professional support and services. This program was created in Australia in 2000, and in 2008, it was brought here to the US. There were several councils and Department of Health and Mental Hygiene in different states that brought this to our country. The US mission of mental health first aid is to provide high quality, evidence-based education so everyone has the first aid skills to support people with mental health challenges. There are more than 2.5 million people across the US that have been trained in this program, and there are more than 15,000 instructors, and I am one of them. So most of us would know how to help if we saw someone, for example, having a heart attack. You know, we'd start CPR or at the very least call 911. But too few of us would know really how to respond if we saw someone having a panic attack, or if we were concerned that a friend or a client or a coworker might be showing signs of alcoholism. Mental health first aid takes the fear and hesitation out of starting conversations about mental health and substance abuse problems by improving understanding and providing an action plan that teaches people to safely and responsibly identify and address a potential mental illness or substance use disorder. When more people are equipped with the tools they need to start this dialogue, more people can get the help they need. And so I want to show you, this is the action plan. Okay, so it spells algae. Oh, and I forgot to tell you, so this little koala, the reason why this is their mascot is because this program started in Australia. And it's really fun when you become an instructor, they send you this little stuffed animal. So I have that on my desk. But this is the algae action plan. Okay. And so I'm going to go through the remainder of the time. We're going to kind of look at this plan. And the action plan centers around assess. See that in the middle for two reasons. First, mental health first aiders need to continually assess whether the individual is in crisis. And the second reason is we should always be aware of any changes to the situation so we can adjust the approach accordingly. Okay. So during this step of the action plan, we are assessing for crises. And although this step of the action plan is labeled assess for risk of suicide or harm, we assess for any crisis, not just the risk of suicide or harm as mental health first aiders. So you can see the things that may become a crisis and then immediate crisis. So panic attack, aggressive behaviors, substance misuse, a traumatic event, or non-suicidal self-injury, those may become a crisis. But immediate crisis, we're talking medical emergencies, suicidal thoughts and behaviors, severe effects of alcohol or drug use, and then psychotic states. So what may turn into a crisis, we do go through this in the class. We go into this and talk about those situations. But for the purpose of today, I'm going to keep moving. So now we're going to go back to A. Okay, so approach. So we've assessed for risk of suicide or harm. Now we're approaching in a non-crisis situation. Okay, so these are some tips for approaching a person in a non-crisis situation. We want to plan to talk privately about concerns at a mutually convenient time in a place free of distractions. We want to be aware that a person may not open up to you until they're sure that you care. A person may also downplay what they are going through to avoid upsetting you, or may not even recognize that there is a problem. We also want to let the person know that you are ready when they are. We never want to pressure to talk right away. Sometimes we can just plant the seed, and people may come back to us at another time when they're ready. Okay, so the L in algae now is listen, non-judgmentally. So I think we would all agree that listening can be challenging, and being non-judgmental takes a focused effort. In this step, we're asking mental health first aiders to do both, to listen and to listen non-judgmentally. So it's not as easy as it sounds. Before reaching out to an individual, it can be helpful to evaluate your own frame of mind and ask yourself, are you prepared to express concern without judgment? Are you the best person to help this person? Can you invest the appropriate amount of time in a conversation right now? Okay. Listening non-judgmentally is really important. as it can help the individual to feel heard, understood, and acknowledged. It may set the tone for this and future interactions with you or with other people in their life. Remembering is also an important part of demonstrating non-judgmental listening. If a person opens up to you and then you forget what they said the next day, they may probably won't feel comfortable opening up to you or others, maybe for a long time. The purpose of non-judgmental listening is to help the person feel heard. Sometimes, but not always, feeling heard is what a person just needs to work through a challenge or a difficulty that they're experiencing. Effective non-judgmental listeners pay attention to two main areas, and these are on your screen: verbal cues and non-verbal cues. Okay, so verbal cues are the things that we say, verbal cues are things that we say, and they can help a person feel heard. So verbal cues could be a question like, how are you feeling? Or how long have you been feeling this way? Verbal cues can also be encouraging sounds like, just agreeing, body language. And that's what we're going to talk about with nonverbal is body language. So what we do with our face and our body communicate whether we're listening or not. So things like our volume and our tone of voice, the emphasis we place on certain words, body language, eye contact, facial expressions, these are all nonverbal cues. Also, I would like to say that silence is a powerful nonverbal cue. Show that you're comfortable in silence, even if you feel a little bit uneasy. Silence is important as it helps a person gather their thoughts and figure out what they want to say to you. I also want to address cultural considerations. Listening non-judgmentally requires that us keep culture in mind. And we want to remember that people come, obviously from different cultural backgrounds. We also need to set aside our own beliefs and reactions to focus on the needs of the person so that they are heard, understood, and helped, most importantly. Additionally, it is important to ensure we do not express any negative judgments that we have. So as you can see up on the screen, we want to respect the individual and their experience. We don't want to make assumptions. We want to be mindful of language and expressions. Recognize what might make it hard for someone to get help. This is a really important one because there are a lot of reasons. Stigma for one, but there are a lot of reasons why someone might not be so comfortable getting help. We also want to set aside our own beliefs and reactions to focus on the needs of the person. And again, not expressing negative judgments. All right, so moving on to G, so giving reassurance and information. So reassurance is a statement, comment, or action that helps remove a person's fears. Information is a set of facts provided about a given topic. Advice consists of guidance or recommendations offered to a person that tells them a specific course of action to take. Sometimes people think of this step as giving hope with facts, and I highlighted that for you. So to give you an example let's just talk about a physical health condition. We could say most people who break their ankle are able to return to their usual activities in the future. This can sometimes involve a cast, rest, and physical therapy. Okay. So that's an example of reassurance and information. For a mental health challenge, we could say, for example, many people who have lost their job feel sad and overwhelmed, but I want you to know that you are not alone in this. Okay. With medical conditions, we generally ask questions regarding getting better and recovering. With mental health challenges, recovery and hope are often missing from conversations. As mental health first aiders, we need to continue to share information about recovery and hope. All right, so giving reassurance and information. Here are some other examples. It does not sound like saying to someone, you really need to talk to a professional about that. Instead, you could say, I'm here for you if you want to talk. There are also people who are trained to help you work through these feelings. Something not to say or does not sound like, you'll get over it, just don't worry about it. You could say instead, you are not alone. Again, another example of it does not sound like, the way you are handling this isn't healthy. You could say instead, I care about you, and I've noticed a change in whatever it is, mood, eating, exercise. All right. All right, so moving on to in algae, the first E, so E1. So this is, I'm gonna just go back to our visual here. So we've gone over approach, listen, give reassurance and information. Now we're going to go to the first E, which is encourage appropriate professional help. All right. I'm so visual. I just need that little visual. Okay, so actually this, what's on your screen, medical doctors, is usually where it starts, where someone can start to get help and ask questions is going to their regular doctor. So medical doctors include psychiatrists and other medical doctors. Okay, so we could start there, and often they will have referrals, to share with the person. Advanced practitioners are nurse practitioners and physician assistants. And there are advanced practitioners who specialize in mental health. So that would be a good place to go. Psychologists are not medical doctors, but in some states, they can prescribe medications. We could also go to social workers, who are professionals who serve people in need. There are many different types of social workers that focus on meeting the needs of special populations, such as child, family, school social workers, medical and public health social workers. Counselors and therapists are professionals who are trained to give guidance on personal, social, or psychological problems, usually on a short-term basis. Then we've got crisis support specialists, are counselors who are trained to give guidance to support individuals in crisis. Substance use professionals are professionals who are trained to assist individuals experiencing a substance use challenge. They can be physicians, advanced practitioners, psychologists, social workers, licensed therapists, or other medical professionals. And then this is one we probably don't think of, but certified peer specialists are individuals who have lived experience with mental health challenges, who have been trained to assist others in their journey to recovery. So one way that a mental health first aider can help others is to connect them to the appropriate help. When you suspect a person is experiencing a mental health challenge, it is important to seek this professional help early. The sooner help is received, the better outcome for the individual in need. Okay. Now, I know we talked a little bit earlier about maybe some reasons why a person may not seek help, such as cost, stigma, logistics, awareness, okay, maybe cultural barriers. We also want to remember that professional help can vary greatly depending on the severity of symptoms, the type of this disorder, and the impact on the person's life. It's a myth that once a person has begun to receive professional help, they will always need to continue to receive professional help. And again, we do not diagnose or provide treatment. Mental health first aid believes that people should have access to treatments and professionals who are the most beneficial to the person. Additionally, we affirm the person in making health decisions with their healthcare providers within their cultural context. So, what do we do though what do we do if someone, says thanks, but no thanks? That is a reality. And like we talked about, some of those reasons why someone might not seek help are very real. And sometimes, despite our best efforts, an individual just may not be ready for help. As first aiders, we must respect the wishes of the person so long as no one is in immediate danger. It may be helpful to suggest resources that can be, accessed privately or at a later time. We want to continue to encourage the person to talk with someone that they trust. We may not be the best person to help that individual with a challenge. If you think a person is experiencing a challenge, you should encourage them to speak with someone that they trust. Let them know that you will continue to be available if they change their mind. We also I skipped this part. I apologize. So these are just the different types of professional treatment. So individual, family, group therapy, medications, and then rehab programs. Sorry, I got off track a little bit here. So again, if the person doesn't want help, we also want to remain patient. Sometimes we plant the seed and we never know if maybe something you said, the person thinks about. For myself, I'm a processor, so I think about things that people say to me for a long time. And so there may be situations where we just need to be patient, and then, the person may come to us, or maybe they'll go to someone else. And we want to remain friendly and open. The person may want your help in the future. All right, the second E, so going back to algae, the second E is encourage self-help and other support strategies. Okay, so what is self-help? Well, it's when a person uses their own efforts and resources to cope with challenges and achieve mental well-being. Not everyone is ready or willing to try self-help, though. And these are some of the ways that we could encourage, depending on the situation, maybe even ask the person, hey, I'm going to this workout class. Would you like to come with me? Or I heard about this meditation group, here's information about it. Peer support groups are really helpful. Maybe a book that could help, or a social network, or hobbies. I think we all can agree that after, sometimes we just need to immerse ourselves in a hobby where we can get our mind off of everything else and just enjoy what we're doing. Okay, so that's the last E of algae. Does anyone have any questions about anything so far?
I don't see any questions in the chat.
Okay. Okay.
I have one.
Yeah.
Alison, I
Yeah.
was talking a little bit earlier about like how we would probably know what to do if we saw a medical crisis, like someone having a heart attack, but how it's different if it's perhaps more of a mental health issue. If we were to see that, which seems like, a greater crisis, maybe someone is having a severe panic attack, or maybe even talking outwardly about suicide, or they're just mentally don't seem safe. Do you still call 911 the same as you would for a medical emergency in those cases, or what's the best resource?
That's a great question that is actually on your screen now. And I don't know if you guys are all familiar with 988, but this is a number that you can call instead of 911 that is for crisis or suicide. So on your screen, they do have a chat. And then there are some additional 988 resources. There's frequently asked questions at the website there. And then there's also a fact sheet that you can look at. And so that is what we recommend with mental health first aid. These are all resources from them. And I do also want to say that in the class, we do get into all of the different possible situations, such as, specifically what different crises, like panic attacks, aggressive behaviors, suicide, psychosis. So we talk about what we would do around that, but in general, this is the number that you can call. So hopefully that is helpful. I know
that's helpful. I've never heard of that before, so thank you for sharing that slide.
Yeah, of course. Yeah, I hadn't heard of it either, actually, and that was probably one of my biggest takeaways after going through the training for mental health first aid, because it's not like something that I think most people know. So I can share this PowerPoint as well, because if you want, I'm sure some of these resources you guys already have, but I can share this too so that you have these. Another resource is the Veterans Crisis Line, and these are for veterans of all ages can call or chat online. And so that's appropriate for the population that we're working with, or anyone who has been a veteran. Also, disaster distress hotline. There's a phone number here for from the Substance Abuse and Mental Health Services Administration that provides immediate crisis counseling for people who are experiencing distress related to any natural or human-caused disaster. So there's a phone number there. And then another thing that I just wanted to share is the Mental Health First Aid website, so mentalhealthfirstaid.org. So they have, if you go to their resources page, there are more resources on this website than I've ever seen anywhere. And I started looking, and it's like a rabbit hole, because you just kind of start looking at all of these sources, but it's a gold mine of information. Also, just so you know, the mental health first aid program. So for example, I'm certified to teach adults, but there are also other certifications. So the other certifications are to teach mental health first aid to kids, which, as we know, is so needed. I was a school counselor for many years, and I wish I would have known about this program then, because many of our kids are really suffering with mental health issues. And this is a program that teaches them how to observe, to become more aware, and to be able to, talk with other kids that they may see are in having mental health challenges. So then there's also a class that teaches adults who work with kids. Okay. So that's another, teachers and counselors and, coaches can take that class. I'm not certified in those yet, but I am really excited to look at those programs. Then they also have, what they call add-ons. And so the add-ons are for specific populations. For example, older adults is one that I'm certified in. So that's where I got a lot of this information. For just different populations, they have special, aligned with cultural competency, and have built these courses to specifically, work with a certain population. And I've been really impressed with it. So here are some additional sources: Anxiety and Depression Association of America, Centers for Disease Control, Productive Aging and Work, Elder Care Locator can connect you with services for older adults and their families. I'm sure we're all familiar with the Area Agency on Aging, Health and Aging, Medline Plus, Mental Health America. And then I won't go through all of these, but I spent a little bit of time looking at all of these websites, and there's a lot of really great information that you can find just about on anything that you're wanting, some additional resources or information about. Okay. Oh, I'm looking at the chat. Yes. Sonia, I will share the PowerPoint. If I just send that to Aznaha, I'm sure they can get that out, and it will be on the website next week. Great. Well, thank you so much. I have put a lot of information into a short period of time here. The mental health first aid class that we offer is 8 hours. So you can imagine we get into it a lot more. It's very interactive, and there are a lot of different videos and resources that we use. If you're interested in any of that information, my number and my email is here. And then our website is ap.training. Certainly, if you have questions, please don't hesitate to reach out to me. I would love to help in any way that I can. Yes, I will send it to you. Was that Laurel, or was that?
That was Linda.
Oh, Linda. Okay. Yeah, Linda, I will send this PowerPoint to you so you guys have it.
Thank you.
Thank
You're
you so
welcome.
much, Dr. Pattison, for sharing information about a topic that seems to gain more and more importance every day.
Yes.
I was traveling in my car and was listening to a different radio station, and they were talking about mental health and just the stigma behind it, and that people just don't want to admit it or come forward about it. And so I think this is very important. I think COVID obviously added a lot to that, especially with younger people. So
absolutely. And they have the organization that we go through for mental health first aid, they are very engaged with social media. They have a lot of campaigns, like Michelle Obama has been their spokesperson, and other famous people. And that's, it's hashtag be the difference. And so, just raising awareness and, trying to destigmatize is really a part of it. So yeah, there's a lot that we can do by just observing and knowing, what we should do to respond.
Alison, are there any statistics showing the differences in, participation in these kind of help groups before COVID and after COVID?
Yeah, I'm sure there are. On the mental health first aid website, they have a bunch of, they're very evidence-based. They do a ton of research. I can look that up for you, but I know I was on there looking at some of their case studies, and yeah, they are looking at that, and there's additional research that is continuing to be done. In fact, I'm doing a study right now with some other colleagues from Grand Canyon University, and we're looking at the fear of COVID amongst family members and how it relates to some different things. So there's research being done all the time. For sure, I can look up and send you some things, but yeah, for sure there is info out there.
I just thought it would certainly help if we had something to go on, because we got to know the next one's coming.
Yeah.
And so if we use the past 3 years as the benchmark or whatever you want to call it, then
Yeah.
at least we've got something to go on next time.
Yeah, absolutely. And I mean, when we talk about the older population as well, I mean, I think whenever I think of COVID, I think of my 99-year-old grandma who is in an assisted living facility. And for basically 2 years, we couldn't see her. I mean, she was like on lockdown, and how that affected her. I mean, it's crazy to think about. And, to do formal research, I mean, I have anecdotal knowing how it changed her and affected her mental health. So, I mean, the isolation and, all of the different populations affected by COVID. Yeah. And to prepare for the next. Yeah, absolutely.
Well, isolation isn't good for anybody, much less
No.
someone that's aging.
No. I mean, I can't even begin to go there in my mind what she faced. I mean, I enjoy being alone to a point, but the isolation, I can't even imagine, just what she, all of those people went through. And I at least was with my family being isolated. I wasn't alone. So,
Right.
yeah. And then all the death around. I mean, everyone in my grandma's facility, both of her neighbors passed away from COVID. I mean, there was just all of her friends died. So, I mean, there's that too. And just on so many levels, peel the onion.
Allison, I have a question. There's also been so much mental health challenges in the younger population. And personally, on my own team, we recently had a young person that lost her life due to suicide. And it's very traumatic and difficult for all of the team members, as well as the member that she cared for.
Yeah.
And I would love to perhaps offer this class to those providers. You said it's an 8-hour class. I just wondered, and you said it was interactive. Is it through Zoom or is that in person? Do you think it would be a good class for them? They're trying to process everything. And of course, survivor guilt or what they could have done, not that kind of thing.
Yeah, I do. I'm a little hesitant because the class, we get into very deep, heavy discussions, and it can be a trigger for people. But there's also the theme throughout this whole program is hope. And yes, I think it does help people who are, grieving to know what they can do to help, it maybe in the future and their own self, their selves. But I think, so we do offer it via Zoom, and it is 8 hours, and it does count if those people are direct care workers, they can get the CEUs for this class. But there is some pre-work that they do beforehand on the computer, and then it's 8 hours of instruction, very interactive. So it's We have talked about splitting it up into 2 different days because it is so much information and heavy. So we're gonna do that in June. We're gonna do a Saturday morning and a Sunday morning. So like from 9 to 12, both days. But then we do offer it the full day too. So it usually goes 9 to 3. And we try to offer them on the weekends.
If they only, let's say, did part 1 and couldn't do part 2, would they still get the 4 CEUs for that? Or do you need to do both parts to be able to?
We can do that. However, they wouldn't get the official certificate from Mental Health First Aid, because this program is kind of, so they get a username and password to go into the website, the Mental Health First Aid website. And then they do their pre-work. They have to do their post-work in order to get the certificate. So if they only did part of it, yeah, I mean, I could work that out, but they wouldn't get the actual certificate.
Sure.
Yeah,
right.
and I can tell you what we cover in the first 4 hours.
Okay.
Yeah. Actually, the second part of the class is more what is crisis and what to do in crisis situations. So
I think a common question and theme that has come up amongst the group is just, what did we miss? You know, what, nothing showed up. You didn't see anything to miss.
Yeah.
And so questions, and maybe, you know, there isn't anything, but because they have those questions, you know, maybe that would be something that would be reassuring, if that, you know, were to come again. I think that that's just the reality. You go through something like that, is your mind just keeps kind of replaying everything and thinking, you know, is there something that I didn't see? And so knowing that information is actually helpful versus, you know, ignoring it.
Absolutely. Absolutely. And I think that this information would be helpful. I also would recommend that I don't know if you guys have an employee assistance program through your company, but I know like through APT, I offer that to my employees where they can go and see a counselor for, I think it's up to 6 or 8 times for free. And that would be something too that, you know, when we teach CPR, I mean, we talk about that, you know, if you have to do CPR on someone, you've got to take care of yourself as well, because it is a traumatic event. And, you know, that's a piece that I think sometimes gets missed. And so when we're talking about mental, you know, any traumatic event like this, I think it's very beneficial to see a professional, you know, therapist to help them kind of walk through that in their own way, because as we know, we all grieve differently. So maybe a combination of the two.
Yeah, if you could give more information on that as well, if you have it, like what that would look like as far as an employee assistance program for mental health. I don't believe our agency offers that, but I would definitely be interested in learning more.
Yeah, I absolutely can. I have a company that I use and I've been real happy with them. So yeah, I can share that.
Any other questions? It doesn't sound like it. So thank you again, Dr. Pattison. This has been great.
Of course, absolutely.
The Alison Board of Directors want to thank you all for participating today. Our June session will be held Wednesday, June 15th, and our speaker will be Robert Espinoza with PHI International. Watch for advertising for this session coming soon via MailChimp. Please make sure you RSVP for the session. Thanks again, everyone, and have a great afternoon.
You too. Thank you.
Bye-bye.